You are watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, she says nobody should be wearing a loose-fitting denture. She is Atlanta's go-to implant dentist, Dr. Kelly Vaughn. Dr. Vaughn, welcome to the program.
Hey, Randy. Thanks for having me.
Good. Now, you're in front of a sign that says Restore 24. What is that?
So Restoring 24 is our brand of teeth in a day. I think a lot of people have heard of teeth in a day, all on 4, all on 6 procedures. And this is our teeth in a day procedure. And we named it Restoring 24 because it not only restores your smile, but it also restores your confidence. And it can be done in as little as 24 hours.
Now, is this true? I think you told me this on the phone, that in certain cases, you can walk in with no teeth and on the same day walk out with upper and lower teeth that don't come out, full arch of teeth.
Absolutely. In as little as 24 hours, all the bad diseased teeth come out, implants go in, and you're out the door with teeth that you can eat with that day.
Is that right? Do you hear a lot of eating stories?
Oh, absolutely. Absolutely. One of our first patients, actually, her name was Janice, and I've got some pictures I can show you later, but her goal was to eat a cheeseburger because she hadn't had a cheeseburger in 7 years. So that was a very joyous occasion for her.
So let's begin with who is the typical dental implant patient that you see?
So it's really 3 categories. The first category are those suffering from gum disease, which turns into periodontal disease, which is a bone-eating disease. So as the bone is lost, they end up with loose teeth, bleeding gums, sore gums, and then ultimately it leads to tooth loss. So these patients are on their way to dentures.
Is that why they go to you? Is that why they go to you?
Absolutely.
They don't want dentures, obviously.
Absolutely. They don't want dentures, and they're looking for a dentist that can provide solutions. And not every dentist has the capability of doing procedures like this.
So the second category, sorry for interrupting.
So the second category are the people with badly broken down and decayed teeth. And this is it's almost like a domino effect. You know, it starts out as the big filling, turns into the crown, then the root canal, then the root canal goes bad, and then you end up losing the tooth. So these are people that I say they're tired of throwing good money at bad teeth because it just never seems to end. And these people, too, ultimately end up in dentures. It may start as partials, but then it turns into dentures. And they know they don't want a denture.
Okay.
And then the third category are those that are already in dentures. So those are the people that started out in category 1 and 2, periodontal disease and badly decayed, broken down teeth, and they thought that the solution was going to be a denture. So they came to the dentist, got all of their teeth out, thought, okay, I'm done. And then they find out there's a whole new set of problems that go along with dentures. Dentures don't fit. Over time, your bone resorbs, they don't fit. They slip around, they cause sores, they can't eat the foods they want. They can only eat the foods that they're capable of eating with the loose denture. They try denture adhesives and find out that doesn't work. So these people have been dealing with a whole new set of problems when they thought they were solving the problems.
Now, in your center, we should mention, this is a big place. Like 10,000 square foot, one of your centers, 10,000
Yes.
square foot. Now, you have this concept where I guess how dental implants are typically done is you go to one place where they do the surgery, then you go to another doctor that puts the teeth on top, and maybe even somewhere else for the imaging, and then you may get your teeth maintained elsewhere. At your office, I guess you do everything right there. Is that why you're able to do it, I guess, faster?
Absolutely. Absolutely. When I built this facility, I built it with the purpose of convenient and complete dental care. So it's a full service dental center, and I'm just part of a specialized team for the Restoring 24 team. But the really cool thing is it's all under one roof. So we have our own lab, which is what makes this possible, because the surgery is done across the hall. The patient comes to me for the restorative. We've got all these cool, gadgets with all the technological advancements around today. This is virtually, almost all digital now. So we're taking these images.
By the way, when you say digital, that means you're planning these surgeries on a computer.
Absolutely. Yes.
Okay.
Everything is computerized. We've even got this cool camera that we're learning to use now. And It's going to eliminate the need for impressions with this. And, no one likes to get impressions at the dental office.
Is that that's the gooey stuff that you put in the mouth?
That's the goopy stuff that causes people to gag, and no one wants an impression made. So this will eliminate that. But it's just, with all the technological advancements and having our own in-house lab, things that used to take 8 months to a year, we can now do it in 24 to 48 hours.
Denture wearers. Let me ask you about this, because we talked about no more dentures. Are there a lot of people in Atlanta or even in Georgia in general that have upper lower dentures?
Oh, sure. So there's over 200 million Americans either missing some teeth or all of their teeth. And just in the Atlanta area alone, you could fill the NFL football stadium, the Mercedes-Benz Stadium, many times over with the number of people that are either in a partial or a full denture.
So if there's so many people that are headed to dentures or currently wearing a denture, why aren't these denture wearers coming in to get teeth that don't come in and out supported by dental implants? What's your take?
I think because most people that are in dentures, like I said earlier, they think they don't have to go to the dentist anymore. So they haven't been into the dentist in some time, and they don't know that we have this capability now. And then, on the other side, if you're in a denture, there's a reason you're in a denture. So everything that you went through before you had the denture, the periodontal disease, the badly broken down teeth, you don't want to go to the dentist. People don't like coming to the dentist. They associate the dentist with pain. There's always been a fear of the dentist. And I just think that's so unfortunate, because there's so many things that we can do now if we could just get everyone in to at least have a conversation with us.
Now, you told me you could probably help the denture wearers the most, and it's just tough to reach them. Do you feel
because
that way?
they're out of the loop. They're out of the loop. That's why I do things like what we're doing here today, this show.
Okay.
I'm trying to educate people on the things that are available to them now. My grandmother, she lost all of her teeth in her mid-60s. She was a heavy smoker, had periodontal disease. And, as a child, I didn't really notice her teeth. But what I do remember is her having to have all her teeth removed, and she ended up in dentures. And I would imagine there was no choice for her then, like a lot of people feel now. And it changed her whole life. She used to go out dancing on the weekends, and she had a social life. And I do remember as a child, she had her teeth removed. She had dentures. She started losing weight. Why? Because she couldn't eat the food she wanted to eat. She was very limited. We'd go out to eat, and she was always the last one to finish. And, it was a very slow process. She quit going dancing on Friday nights.
Interesting.
I don't know if I would use the word recluse, but it definitely changed her life. And it hurts my heart that someone in my town didn't offer something like this to at least give her that choice.
How old can you be to get a brand new set of teeth supported by dental implants?
I think the earliest or the youngest we've had is a girl in her early 20s. And then we see patients in their 80s and 90s even. Because these people, I think people are shocked that someone in their 90s would come have something like this done. But after years of denture wear and pain and discomfort, and honestly, I don't even know how many times I've heard, I just keep my denture in the bedside table. So
right?
this is a life-changing thing for people. And why wouldn't you want to live the rest of your life to the fullest, to be whole again?
You believe no more dentures. You think that's the future of dentistry?
Absolutely. Absolutely. People come to us all the time. Like I said, not every dentist is capable of providing treatment like this. So they get options like the conventional dentures and then snap-in dentures. And a snap-in denture to me is just a glorified denture. You still have to take it out every night.
Okay.
And with the advancements in technology and the material choices we have, we're cutting this down to 2 visits. Time is money. For the amount of money you're spending on a snap-in denture from the past, you could have something fixed and permanent that you don't take out. And why wouldn't you want that? You and I take it for granted having a fixed set of teeth and eating what we want when we want. And I just think that I think this is the option, not just an option, but the option.
Yeah, but isn't it true that, I mean, if you've been wearing a denture like 10 years, you can't do this? You don't have enough bone.
No, that is absolutely not true. You have enough bone to do this. That dental office down the road may have said that, but it's only because they don't do this. They don't
Okay.
do this every day. So there is absolutely enough bone. And like I said before, if I could just get in touch with everyone in a denture and at least have them come in and have a conversation with us, I think they would be pleasantly surprised at the experience they have.
Okay. Now, what about gum disease? Okay, so if you have gum disease, are your gums too bad to be able to do this?
No, actually, usually with this procedure, you're taking all the bad out. So there's such a health benefit with this as well. You can absolutely have this procedure, and many of our patients, just after the surgical portion, talk about how much better they feel after just getting all that disease and decay out of their mouth.
So this infection, like gum disease, lives on the old teeth. Is that kind
Absolutely.
of how it works?
Yes.
So when you remove them,
Yes.
the infection goes away.
Yes, yes. We're cleaning all of that infection out. One of the patients we had, he came in the next day to get his new set of teeth. And the first thing he said was, I went home last night and I swished cold Gatorade around in my mouth. And he just loves ice cold orange Gatorade. And he didn't have any pain. He had no idea how bad he felt until all of that bad decayed teeth and disease came out.
I got tired of being around family and friends and not being able to smile and being able to talk. And I woke up one morning and said, hey, this is it. And coming to Restoring 24 has been life-changing. But the greatest joy I had in Restoring 24 was my 86-year-old mom. My 86-year-old mom saw my teeth and she broke down and started crying. She was, and not tears of sadness, but overjoyed that in her lifetime she got to see her baby boy with teeth that look good.
We're actually going on vacation this weekend. First vacation we've had in years because of my new teeth. So I used to didn't want to go nowhere. I just wanted to stay around the house. My friends and family, they were blown away. I mean, how real it looks. I mean, it looks like a real smile. The thing I'm most excited about eating is tacos. I'm gonna get about 50 tacos and chow down. I've been craving one so bad. So
I've had problems with my teeth, and they've progressively gotten worse and worse. And it got to the point where I was kind of embarrassed even to smile. The first time I saw my new smile, I just couldn't believe it. There was a big time relief that I could smile and not worry before I had to smile. I could just smile away. My favorite thing to eat now is fried chicken. Just because I can take a big bite and not worry about it, and I haven't had it in a long time. My friends and family are actually kind of shocked about my new teeth. I see them, I catch them looking at me, and all of a sudden they say, wait a minute, and just look and they look and they look, and then they just smile real big at me too. I feel confident about my new smile. I feel happy, and I'm happy to smile. It's just been missing for a long time, and I feel rejuvenated, I guess would be a good word.
Now, what about sedation? What do you offer in your practice? Because you say pain is not something that should worry somebody or keep them from doing this.
Absolutely not. This is not the this isn't the dental office that you went to as a child. We have IV sedation and we have conscious sedation. And honestly, the majority of our Restoring 24 patients choose the conscious sedation. So it's just a little blue pill, you fall asleep, you wake up, go home, and usually when you come back the next day, you don't even remember talking to me.
Is that right? And now, when people come in, what do they like more? Do they like the way it looks? Because I'm trying not to endorse you. I've seen some of your photos, very, very nice. But do they like the way it looks, or do they like what they could eat and chew?
People that come in, they just want to eat. Those are usually the men. They don't want you to know that they're worried about the way they look, but they get the new set of teeth, and I think 8 out of 10 come and talk about the ladies. All of a sudden they've got a new social life that they didn't have, and it's all the
Okay.
benefit of their new smile.
That's very nice. Now, you brought up a photo of a patient that you were just talking about. You want to get that? Let's take a look at that.
Yes, absolutely. So this is Josh,
Okay.
and Josh came to us. He had suffered with badly decayed, broken down teeth since high school, periodontal disease. Had he not come to see us, he would have ended up in a denture. And he's just much too young. Really, any age is too young to be in a denture. And here's the after shot of Josh.
Looks good.
And as you can see, I mean, he looks amazing. His personality, he's just such a wonderful person. And I'll say this a lot. They're all our favorites, but he is truly one of our favorites. And it's changed his life. I mean, his wife, they drove, I think, 3 or 4 hours to get here. And when he came back to see us, he said, my wife couldn't take her eyes off of me.
That's nice. When you put those side by side, you could see it's a dramatic difference. Because I always
Absolutely.
think that, when we talk,
I
it
mean,
sounds almost
you can
like...
see, yeah, I mean, he just looks happier. He looks more successful.
That's true.
He just looks incredible.
And this is kind of going on every day in your practice.
Every day. Let me show you this next patient.
All right.
This is Valeria.
Okay.
And Valeria, you can see she's suffering from broken down teeth, periodontal disease. And as a result of that periodontal disease, the tooth become mobile. And you can see by that front tooth there how it's dropped down some. So really that's where your eye is drawn to that single tooth there in front. And she just wanted to be able to smile again. And when we finished with hers, you can just see,
Wow.
I mean, a totally different person. You can see the characterization in the teeth. We've got that nice feminine touch there. It follows her lip line. And she's one of my favorites because I was showing my son at home our before after photos for those days cases. And when I got to hers, he said, "Oh my gosh, she's beautiful." And I just, I told her the next day she came in, but I just thought that was amazing. And she could not be happier. She was hiding her smile, and now all she does is smile.
Is this one of those things where they say, boy, I wish I'd have done this years ago?
Oh, absolutely. Absolutely. I think it's one of those, they wish they would have known it existed years ago. This next one, this is Janice.
Okay.
And Janice, what you can't really see there is she's in a lower partial because of tooth loss, and she's in an upper denture already. And as you can see, you can't even see the upper denture. And she was tired of eating soup, she said. She would avoid social situations, didn't want to go out and eat with family or friends because she said she was sick and tired of soup, and it was embarrassing for her.
Let me ask you a question. So these people
Sure.
with their teeth, they're so bad and painful, they can't eat sandwiches or chewy things like pizza or nuts. That's off limits.
Yeah. It's pain and discomfort if they have
Okay.
if they have their own teeth and they're broken down. There's pain and discomfort, temperature sensitivity, and then in her case, the denture, she just couldn't wear it. She had the denture, I think it was about 7 years, and because of the bone loss she suffered as a result of the denture, she just couldn't keep the denture in, which made it very difficult for her to eat and difficult for her to just go out in social situations and smile and laugh because it wouldn't stay in. So then you can see by the after here, I mean, this is a whole new woman. She cried. And she
Wow.
said, the first thing I'm going to do is go get a juicy cheeseburger because I haven't
Nice.
had one in 7 years. Yeah, she's an amazing person, and I'm just so happy for her. And then this next one, this
All
is
right.
Gerard. This is our Gatorade drinker.
Okay.
So he's a rapper and a musician in the Atlanta area, and he got the grill to cover up some badly decayed teeth. And I don't know if grills are still in fashion, but he decided he wanted to get rid of the grill. And when he tried to do that, he realized that what was underneath, there wasn't anything underneath. The decay had just eaten away at the teeth. So took out all those badly decayed, broken down teeth and gave him a new smile. He brought his whole family in to see him.
Looking good, looking good.
Oh yeah, he looks amazing. And let me tell you, his personality, it's contagious. He is so happy with these new teeth. All he does is smile. He was FaceTiming friends from the chair. He was posting it on social media. I think he's told everyone in the world about us. And again, just so very happy for him. And then here's Anita. This is Anita. She came and she was missing several lower teeth. She had an upper partial. And really her main concern was her lower because she only had a few natural teeth remaining and she was having a hard time eating. So we gave her new teeth on the bottom. And before she even got home that day, she had her husband give us a call and she scheduled for the next week to get her upper teeth done as well.
That's a good story.
This is the final.
Wow.
And this has just changed her life. You know, this she reminds me of my grandmother. You know, she was on her way to a denture. She had already dealt with a partial. She knew she didn't want something that she could take out. And I'm just so happy she allowed us to do it.
And we're kind of short on time, but on these consults, they're telling you their hard luck story, and let's say that they know they're going to end up moving forward with the treatment. Do you ever get excited, like thinking they have no idea how good this is going to be?
Oh, absolutely. Yeah, I think that a lot of these people, like you were saying earlier, they just want to eat, or they just think that they're going to get the smile that they've wanted, and then once they actually get the new smile, it is changing their entire life. And I don't think that they knew what was in it for them. You know, we've got the men talking about the ladies, like I said. We've got people that, started dating. Now they're getting married. We've got one patient that he was overlooked for a promotion several times. His supervisor actually came to him and said, you know, you've got to do something with your teeth. You're a professional.
Wow.
You're dealing with clients every day. Well, he got the promotion. Now he comes in a different car every time I see him, you know, Maseratis, and it must have been a nice promotion. But these are things that, you know, are happening for these people. And, you know, there's a million magazine articles, scientific research. You know, one of the first things people notice, one of the top 3 things, it's your smile. And the more you smile, the healthier you are. You know, when you can eat what you want and not just what you can, there's better health. I just think overall, these people don't know what they're signing up for. They just thought it was going to be, you know, I'm just going to get all these bad teeth out and I'm going to be able to smile again. And it really does change their lives.
You say that people with bad teeth sometimes can be judged.
Yes, I think so. I mean, you know, if you're a villain in a movie or a homeless person in a movie, it's they've usually got bad teeth.
Good
I
point.
I think when people have these badly decayed, broken down teeth, you're perceived as less intelligent, you know, lower income. There's so many negative connotations that go into it. And it's just amazing the transformation when you give them the smile that they deserve, really, just how everyone else around them sees them differently.
Good. Now, for people just tuning in, Restore 24, and correct me if I'm wrong, that's your system. That means somebody could walk in today, get a consultation, they have no teeth, tomorrow get upper and lower teeth that don't come out. Is that correct? I mean, if everything works out right.
That is, if everything works out right, you can have an entire new smile, permanent smile, and your final smile, no temporaries, in as little as 24 hours.
Has that ever happened?
Yes, it happens every day.
Are you embarrassed by your smile or tired of your messy loose dentures? In as little as 24 hours, Restore in 24 can give you back your confidence with a new permanent smile. No temporaries or months of waiting like some other procedures. Visit RestoreIn24.com or call now for free consultation and see how you can save thousands compared to other full mouth implant solutions. Restore in 24, the advanced and full mouth solution. Restore your smile. Restore your confidence. Restore in 24.
Do people do this sometimes for occasions like daughter's getting married, they're single again? I think you mentioned that. Is there usually something in their lives that's happening that
there is, and you know, I mean, we've got talking about getting married, we've got a patient that I'm thinking of in particular. He wanted a nice smile for his daughter's wedding photos, so he came to see us
Good.
for that. And then I think sometimes too, it's they do it for other reasons. The grandparents wanting to be around the grandchildren and present the best version of themselves, the quality time, and they don't want something holding them back. So I think there's different motivators for different people.
Now, I have to mention this because people email us and ask us questions. Insurance, Medicare, Medicaid, even the best dental insurance only covers a small part of it. Those other things don't cover it at all. So what's the answer there?
Yeah, but people every day are coming to see us and they're getting this financed. We work with several local banks in the area. And like I said, the majority of people are financing this.
Is that right? So they're like every day, every week, you have people that are financing
every
these
day.
procedures?
Some people don't need the financing, but if you do, we will guide you and hold your hand every step of the way. Do I have time for a couple of more photos?
Yes. Got about a minute and a half left,
Fantastic.
so go ahead.
Okay. So this is Craig. And he was getting ready to go to Cancun on a vacation with his wife and friends. And, really the same type of story. Badly broken down teeth, periodontal disease, knew he didn't want a denture. And this man, this is one of my favorite afters as well. This is a new man. He's looking good. And then we've got Ben. Ben just wanted to be able to smile for his children. He had badly broken down teeth, periodontal disease, just wanted to be with his kids and be able to smile, didn't want his kids commenting on the teeth. And then here's his after. Taking tons of pictures with his kids, in the floor playing with his kids, smiling. Now they're seeing daddy happy. And this is Josh, another one of our favorites around here, contagious personality. He had a partial, got tired of taking it in and out. His mother just wanted him to have something fixed. So here's his after. He cried, his mother cried, we all cried with them. And then here's AC. AC was also on his way to a denture, and he just wanted to be able to hang out with friends and family and not worry about a denture, eat what he wanted. And then here's his after.
Looks good. And they can eat whatever they want.
They can eat whatever they want. It's amazing. These things are secure and solid.
When it's all healed up, they could eat things like even beef jerky, or they can eat
absolutely
like chewy, really hard. So it doesn't matter. They can eat whatever they want.
It doesn't matter. These things are anchored by the implants. They are fixed in place, and because of the materials we have today, they are so much stronger and just they're absolutely beautiful and amazing.
So no more dentures.
No more dentures. Just say no to dentures.
Okay, good. Final message. We're out of time. Somebody watching this, they're in the two categories possibly: bleeding gums, bad breath, loose teeth. They're headed for a denture, and then there's the denture wearers. They're watching this too. But let's say they've heard what you had to say, but they're still skeptical. What do you say to them?
I say just come in and have a conversation with us. I think that you will be pleasantly surprised at what you learn, and I think that you will find it is a very positive experience.
All right, and those people that are watching, by the end of this week, they could have new teeth.
Yes, by tomorrow.
Dr. Vaughn, thanks for coming on the program.
Thank you for having me.
You've been watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.